A disease either infectious or toxic in nature caused by agents that enter the body through the ingestion of food are all categorized under foodborne diseases. Classification of foodborne diseases. First is foodborne infections and foodborne intoxications. Foodborne infections versus intoxication. We have agents, infections, infectants, intoxications, i.e., toxins. Bacterial, typhoid, paratyphoid, salmonellosis, staphylococcal intoxication, streptococcal infection, botulism, shigellosis, brucellosis. Natural is lathyrrism, endemic ascites, bacterial is botulism by staphylococcus poison. Viral, viral hepatitis and gastroenteritis from parasite, teniasis, hydatidosis, ascariasis, amoebiasis and trichinosis. Fungi, aflatoxin, ergot, fusarium toxin. Chemical, heavy metals like mercury, cadmium and lead. Pesticide residue, DDT, BHC, asbestos, oil and petroleum derivatives. Portal of entry of infections or infectants. Invade and or multiply in lining of intestine. Incubation period hours to days. General symptoms include diarrhea, nausea, vomiting, abdominal cramps, fever. Transmission factors spreads from person to person, inadequate cooking, cross contamination, poor personal hygiene, and bare hand contact. And on the other side of intoxications or toxins, portal of entry, no invasion or multiplication. Incubation period minutes to hours. General symptoms include vomiting, nausea, diarrhea, diplopia, weakness, respiratory failure, numbness, sensory or motor dysfunction. A transmission, it is not communicable. Inadequate cooking, improper handling temperatures. First is lathyrrism. Toxin boa present in seeds of the pulse kesari dal or Lathyrus sativus is responsible for disease neurolathyrism in humans if the person consumes continuous for more than 3 months. Aflatoxin storage fungus agent is Aspergillus flavus and Aspergillus parasiticus toxin. Food grains usually infect the groundnut, maize, parboiled rice, sorghum, wheat, rice, cotton seeds, and tapioca. Precipitation conditions, improper storage, moisture above 16% and temperature between 11 to 37 degrees Celsius. Effect is hepatotoxic. Control and preventive measures, proper storage after drying and maintaining moisture below 10%. Third is ergot, which is field fungus. Agent is Claviceps fusiformis. Ergot fungus or toxin. Food grains usually infest bajra, rice, sorghum and wheat. Effects, ergotism, nausea, vomiting, capillaries constriction, gangrene. Control and preventive measures, remove by floating in 20% of salt water, hand picking or air floating. Endemic dropsy, cause contamination of mustard oil with argemone oil because of close resembling. Agent is toxic alkaloid from argemone oil. This name is sanguinarine. Effect, bilateral swelling of legs, diarrhea, dyspnea, cardiac failure and death. Test to assess nitric acid test. Nitric acid plus oil. It converts brown to red color. Appearance of argemone oil is positive if the argemone oil is about 0.25%. Second is paper chromatography test, which is the most sensitive test. Detect argemone oil up to 0.0001% if it is endemic ascites. Cause is contamination of gondli or millet panicum miliare with wheat seeds of Junjunia, which is Crotalaria. Agent is pyrrolizidine alkaloids and Junjunia seeds. Effect is hepatotoxic. Preventive measures: de-weeding of Junjunia seeds by simple sieving, which are considerably smaller than millet. Sixth is Fusarium toxins or field fungus. Agent is Fusarium incamatum. Food crop, it affects our sorghum and rice.